owning the house is a bad idea. You see, a lot of banks actually want to give you loans. Please.
നോ സെയിൽസ് ടാക്സ് ആൻഡ് നോ ഇൻകം ടാക്സ്. തുടങ്ങാം ദുബായിൽ നിങ്ങൾക്കൊരു കമ്പനി.
Shall we pray? പിതാവിനും പുത്രനും പരിശുദ്ധ റൂഹായ്ക്കും സ്തുതി ആദ്യം എന്നേക്കും തന്നെ ആമേൻ. സർവശക്തനുമായ ദൈവമേ, സ്വർഗ്ഗസ്ഥ പിതാവേ, ഈ പുതിയ ദിവസത്തിനായി നന്ദിയും സ്തോത്രവും അർപ്പിക്കുന്നു. പലയിടങ്ങളിൽ നിന്നായി ഒരുമിച്ച് ഞങ്ങൾക്ക് ഈ ഓഡിറ്റോറിയത്തിൽ കടന്നു വരികയും ഈ പുതിയൊരു സംരംഭം, ഈ പുതിയൊരു ലോഞ്ചിങ് ഞങ്ങൾക്ക് ഇവിടെ നിർവഹിക്കുവാൻ തക്കോണം ദൈവം ഞങ്ങളുടെ ഹോസ്പിറ്റലിനെ ഇത്രത്തോളം വളർത്തിയതോർത്ത് നന്ദി സ്തോത്രം അർപ്പിക്കുന്നു. വീണ്ടും തിരിഞ്ഞു നോക്കി കഴിഞ്ഞ 8 വർഷക്കാലം ഞങ്ങളെ ഇത്രത്തോളം വലുതാക്കിയതോർത്ത് സ്തോത്രം. പ്രത്യേകിച്ച് ഇന്ന് ഈ പുതിയ സംരംഭം ആരംഭിക്കുമ്പോൾ അതിന് ബന്ധപ്പെട്ടതായിട്ടുള്ള എല്ലാ കാര്യങ്ങളും അറേഞ്ച് ചെയ്യുവാൻ ദൈവം സഹായിച്ചു. അതിലൂടെ അനുഗ്രഹം പ്രാപിച്ചവർക്കായി നന്ദി. ഇനിയും 100 കണക്കിന് സഹോദരി സഹോദരങ്ങൾക്ക് ഇതൊരു വലിയ അനുഗ്രഹമായി തീരുവാൻ ദൈവം സഹായിക്കണമേ. ഇന്നിനി നടക്കുവാൻ പോകുന്ന എല്ലാ പ്രോഗ്രാമിലും അവിടുത്തെ സാന്നിധ്യം ധാരാളമായി ഉണ്ടായിരിക്കണമേ. പ്രാർത്ഥന ഘട്ടത്തിനായി നന്ദി. യേശുക്രിസ്തുവിന്റെ വിലയേറിയ നാമത്തിൽ തന്നെ ആമേൻ.
Thank you very much, Acha.
Dear audience, get ready to discover yourself as the colors of this event embellish us all together. To mark the beginning in the right tone, I would like to call the brainchild of our program. He is the reason why we're standing together over here to conduct this event. Mr. Mohammed Faisal started his professional journey As a clinical pharmacist in charge for 4 years in Astromims and as inpatient pharmacist for 2 years at Medcare Hospital in Sharjah, UAE, and CME coordinator at Sharjah Medical District, UAE. He is currently the pharmacist in charge at Public Health Center in the UAE since 2020. The one part where we are all scrutinized for is quality. So yes, he's a certified professional for quality implementation in hospital under the Consortium of Accredited Healthcare Organization approved by National Board for Quality Promotion in 2017. He's also an internal assessor for National Accreditation Board for Hospitals and Healthcare Providers in 2007. Now let's invite Mohammed Faisal, one of the founding directors of FCPI, for the welcome speech.
Respected dignitaries, beloved faculty, dear doctors, and dear fellow clinical pharmacists, dear clinical pharmacy interns, dear colleagues, and those who join offline and online, very warm good morning to all on this pleasant day. Welcome to the launch program. Today, the 22nd day of September 2022 is a very important day. It's the day for happiness for us and all clinical pharmacists over there in India. And today is the day to remark happiness for all clinical pharmacy professionals in India. And today is the day to remark a success story of a teamwork, and the team is called by FCPI, that is Federation of Clinical Pharmacists in India. On behalf of this federation, I'm very glad to note a welcome address on this precious stage. So we are very honored with presence of Reverend Father Sijo Pandapatil. Very welcome you, sir. We welcome you on behalf of this federation. Thank you so much. And we have another great personality, Dr. George Chandy, sir. We welcome you. We proudly welcome you on this launching program of our Federation of Clinical Pharmacists in India. And we are blessed with another great personality, and it's our chief guest, Mr. Dinesh Kumar, Mr. K.R. Dinesh Kumar. We welcome you, sir. We welcome you for this launch of FCPI. And we have Grace Mary John, President of our Federation. Welcome you, dear Grace. Welcome you. And we have Mr. Mohammed Rashid, our Vice President. We welcome you, we proudly welcome you to this program. And we have another brainstorming personality among all the clinical pharmacists in India, Mohammed Hisham. I personally and on behalf of this federation welcome you to this program. And we have another intelligent and talented Maman Paul. He is the technical head of this federation. We welcome you on behalf of this federation. We have a few more dignitaries. We have Dr. Jomsi Jor, Medical Superintendent. Welcome you, sir. We have Mrs. Mini Sara Thomas, the CNO of Believers Church Medical College Hospital. Ma'am, we welcome you on behalf of this federation. And we have Dr. Nitin Manohar, the Head of Pharmacy Practice Department at Pushpagiri Pharmacy College. Most welcome you, sir. And on behalf of this federation, we proudly welcome the pharmacy manager of Believers Church Medical College Hospital and other faculty and other administrative officers of this great institution, Believers Church Medical College Hospital. On behalf of this federation, FCPI, we proudly welcome you all to this great event called FCPI launch. So let me conclude my welcome address, and I wish you all a lovely day and a pleasant day ahead. Enjoy the session. Thank you all. Thank you so much.
Thank you for your enthusiastic welcome speech.
Next, I call upon the stage Reverend Father Sijo Pandapallil to deliver the presidential address. Achan is the manager of BCMCH, Senate member of Kerala University of Health Sciences, and spokesperson and PRO of Believers Eastern Church.
Good morning. Good morning. Indeed, it's a great privilege to be here this morning. Our director and CEO of Believers Church Medical College Hospital, Dr. George Chandy Metitra, the president of FCPI, Dr. Grace Mary John, and all other dignitaries, my colleagues, the clinical pharmacist attending this function. I'm not sure if those who are online are Malayalis or non-Malayalis. Malayalis. Mixed. I would rather continue my speech in Malayalam. I'm very comfortable speaking in my own mother tongue. The introduction was to just let you know that I also know a little bit of English, no? But in any case, when Dr. Grace told us about FCPI, I actually didn't know what it was, but then went ahead and learned further about it. To form an organization, it is not an easy task. To form a federation, not an easy task. And I must congratulate the leaders of FCPI for forming an organization for the clinical pharmacist in India. I think it's one of those moments that will be written in the history. After 5-10 years down the line, people would remember that this was the day that it was launched, and you were the leaders, pioneers. Like when we talk about Dr. Chandy, we'd say that he is one of the pioneers in liver transplantation surgeries in India. So maybe another 10-15 years down the line, people would proudly say Dr. Grace and others who are here are the pioneers of FCPI in India, and that would be a great, great achievement. And I am proud to say that I don't know in India, but in Kerala, Believers Church Medical College Hospital is the largest service providers for the clinical pharmacist. I don't think any other hospital have this many numbers of clinical pharmacists in Kerala. But I must also admit the fact that when Dr. Chandy took this initiative, I thought this man has gone wrong. He has gotten some 20 people at a time, and then had interviews and bringing in. I was thinking, Sir has some agenda to waste a lot of money. Why this clinical pharmacist into our system? But then now down the line, when you look at our hospital, we have these young people, very energetic, educated, brilliant minds everywhere, not just into clinical pharmacy, but then into our administration, into our social media, IT, a lot of areas their presence is there, and we don't just use them for the namesake, but they are involved in daily administration of the hospital. They are involved in making the lives of our patients better. They are involved in advising our doctors and nurses or paramedical staff, and they are very much part of our family. And I think that start of giving a bunch of people an opportunity to perform in this hospital would also pay the path for many other hospitals to take this initiative. And I learned that Dr. Grace was in some other places the other day for meetings, and I also understand probably in October or the coming months you have planned to have a international conference in January 2023. There is an international conference coming up and organized by this group. So I'm very, very happy this morning to be here, and I appreciate again all those dignitaries here. I don't want to take you by name, not due to lack of time, but I sincerely appreciate from the bottom of my heart for organizing this event, and special appreciation for our own Dr. Grace Mary John, the president of this FCPI, for taking this initiative to organize such a meeting. And have a wonderful day. God bless you all, and let this federation make many more such events and make history in our nation. Thank you so much, and God bless you all.
Thank you, Sijo Acha. Please stay on the dais, Acha. Thank you very much, Acha. That was our early morning energy drink that gave a huge kickstart to this event. I request Dr. Grace Mary to give the memento as a token of our appreciation and love to Sijo Achan.
Now we'll be talking about the next pillar of FCPI. She's the glue that holds all 40 CPs in BCMCH together. She's none other than Dr. Grace Mary John, Infectious Disease Clinical Specialist and HOD of Clinical Pharmacy Department, Assistant Director of Believers Church Medical College Hospital, Assistant Professor of Pharmacology in Believers Church Medical College. She's one among the 6 ambassadors selected globally and among the 2 from India, and the only clinical pharmacist to represent India in Society for Health Epidemiology of America. She has American Board Certification in Infectious Disease. She has attained training in antibiotic stewardship with Infectious Disease Clinical Specialist and the Antimicrobial Team at the Tufts Medical Center, Boston, US, and Detroit Medical Center, Michigan. I feel very privileged to call Dr. Grace Mary John to give away the inaugural address.
Good morning, everyone. Like Achan is saying, this is like one of the defining moments in our profession for all the clinical pharmacists, because this has not started not in 1 year, not in 2 years, but more than that. Because I remember the meetings that we've been having for so long, the late nights, brainstorming, the ideas coming in, how to execute it, making it into a team. So I'm here to welcome you all for this defining moment for our profession. We are valuing your presence to mark this amazing event. And I'll tell you what I had to go through when the whole thing started. I mean, at least my profession started. So in 2008 was the first time PharmD, the Doctor of Pharmacy course, was introduced in India. Before that, we are still having the MPharm pharmacy practice, which usually brings out the clinical pharmacists. And that has been there for some time, but it will be like 2 persons per college kind of thing. But when PharmD came, it's like 30 per batch. Even now it's 30 per batch. And more than 6,000, I think more than 6,000 graduates are there per year when it comes to clinical pharmacy in India. Now, I belong to the second batch in India, and the catchphrases that were used when, for us to take this course, to take this profession, no entrance, it's a longest degree, it's the longest thing that you can study, 6 years. It's more than the medical education. And it is an integrated postgraduate course. And all of a sudden, after 6 years, you become this doctor, so you will be able to write the prescription, blah, blah, blah. All these things were the catchphrases that got us into this one. And I'm sure all the students here, all those who are listening online also, this is what has caught you to get into this profession. But the struggle was real because, like I said, we were the pioneers in one way or the other, and unfortunately, there was not enough people. It was not enough people to train us in the right way, to get the clinical skills, to understand, to vertically integrate what we are learning in theory to the practice that is needed. When it comes to patient care, you have to be with the patient. Nobody taught us that. You have to be with the patient. So if you have to be with the patient, you need to have certain skills. You can't just go and stand there, right? You need all those things all the skills. You need to educate them to make sure you are also a service provider. You have to uplift yourself to that position. Now, all these struggles, because the challenges all of us faced, the new members also faced, was different. In different hospitals, it was different. It could be the lack of administrative support initially. It could be the lack of knowledge for all. And therefore, the need for networking to understand the right practices and to make sure that we are into this seamless care of practice, we thought of coming together. So the idea started in 2018-19 because I remember it very well, because in 2019 was the time I was deputed from Believers to go and train in ID in CMC. So we had a small team that used to come together every night online, and we used to have these long meetings till 1 o'clock, 2 o'clock, just thinking how to do it, how to get everyone together. And that's how the idea popped up. And after a lot of discussion, after getting more people into this team, to work for this team, we had in 2020 the team, and we legally registered this federation in 2020 and formed the ID Forum. And you know what happened in 2020? COVID, right? Everybody got busy. Every healthcare professional that you possibly know got busy. And still, even though we are all working clinical pharmacists who are taking extra time from our own personal life to make this work, to make this into this federation. And with a lot of struggle, we had started to bring out the contents, the preparations for the blogs, the webinars, and the teams. All teams were set, multiple meetings, day after day meetings, weekly meetings, monthly meetings, then energizing meetings also whenever our spirits are low. And today we stand here for the launch of the clinical pharmacy, the Federation of Clinical Pharmacists in India. To introduce to our board of directors, this federation right now is comprised of working clinical pharmacists, and this is something we are extending it to the students to train the budding clinical pharmacists, our fellow clinical pharmacists. So we have over 70 working clinical pharmacists with us in this FCPI, and I would like to introduce you to the board of directors. As I told you, it initially started as a small group, a very small group of 4. That was Dr. Mohammed Hisham, Mr. Mohammed Faisal, Mohammed Afzal, and as you can see, and myself, we were the 4 founding directors of this Federation of Clinical Pharmacists in India. We had such great discussions in the initial phases. Then we thought of bringing in the new people, and as you know, they have elected myself as the president for the Federation, and Dr. Akhil Babu, Dr. Mohammed Rashid is the vice president of our Federation, and he is working as a PhD scholar in the Manipal University. Then is our Secretary, Dr. Akhil Babu. He is our own clinical specialist in neurology, BCMCH. Then the Joint Secretary and our technical head, Dr. Maman Paul. He is the brain, as you know, even for believers, he is the brain when it comes to technology, and he has been exceptional with whatever he's been doing. And Dr. Anita, although she was a critical care pharmacist in Indraprastha Apollo in Delhi, and she is our treasurer. And again, to just say a few things about my directors, my founding directors, Dr. Mohammed Isham. He is the clinical staff pharmacist at Cleveland Clinic, Abu Dhabi. And he, to me, is my guru when it comes to board certification. So he got double board certified in critical care and in infectious diseases. So my interaction with Bhaiya and Faisal and Rashid and Afzal, they all taught me what the importance of board certification is, how to get into that whole thing. So networking really helped in the professional career for ourselves, and this is what we want to extend to others also. And Mr. Mohammed Faisal is the clinical pharmacist and the pharmacist in charge of Ministry of Health and Prevention at Sharjah. And Mohammed Afzal, he is the pediatric pharmacist in Amana Healthcare in Alain. So with all of us at different locations, as I told you, this is something, it's defining because this is the first time some of us are meeting for the first time as well. And in our FCPI, we have the advisory team because our teachers are needed for us. Those who taught us, they can help us in a lot of ways. So we have a lot of teachers into our association, which comprises the advisory team, and from all over. It's not just Kerala, it's all over India. And we have the specialty forum. And this is the highlight of the federation, that we have a lot of specialty forums. And the specialty forums, we are starting with the infectious diseases specialty forum, and we will be having other 12 more specialties like critical care, pediatrics and neonatology, then general medicine, transplantation, nephrology, neurology, hematology, oncology. All these specialty forums will come in this one, but we are launching with the infectious disease forum first. And then we have the working committees to make sure that it stays together, everything goes streamlined. And we have the editorial committee, the election committee, the finance committee, and IT and communication. And we have the people who are there to execute things. We have the people for the execution of this federation. Now about FCPI, as I've told you so far, it's a not-for-profit organization. It's a registered organization composed of a bunch of very passionate clinical pharmacists from India, and abroad, who are working abroad, who are involved in diverse clinical pharmacy responsibilities. And we have all come together voluntarily. There's no compulsion on any of us to contribute to this forum. We are here by ourselves because we feel that it's our need to make sure our profession, the one we stepped into, is taken care in a very good way for you guys, for the interns, for the students. So this is voluntary contributions from a bunch of people like us to educate you towards the excellence and empowerment in your profession. Now, we will be showing you the practitioner-led support system to provide pharmacists the opportunity to network. Because I told you, my board certification came as part of my networking with Dr. Hisham. So now we are expanding it to others so that we could network, not just for the exams and things like that, but for our clinical stability as well, and to collaborate in academic research and in every possible way, and to share the best practices. Each hospital works in a different way, and each hospital has its own unique ways in delivering clinical pharmacy services. When we come together as an when we come together as a federation, we are sharing the best practices, which can be translated to other institutions as well, and eventually thereby stimulating the skills of clinical pharmacy. And we are all handpicked, and we have different specializations in the areas of work. Now, like I said, Our mission is to enhance high quality patient-centered care by supporting clinical pharmacists to practice at the top of their expertise, thereby uplifting the clinical pharmacy profession to best serve our patients and our society. Our vision: to develop advanced clinical pharmacist roles and responsibilities, to integrate with multi-professional teams for optimizing pharmacotherapy in the prevention and treatment of diseases. So with this vision and mission, we are here to teach you in every way possible. Now, I would like to take this opportunity also to heartily thank all the institutions that has taken up clinical pharmacist, because I remember my first interview with our director when I was doing my internship in 2019. I took an appointment with him I remember very exactly, it's December 8th. I came to your OPD just to see you, just to see if there's a possibility, because if you will take a clinical pharmacist. Now the good thing what happened was that he had no clue what a clinical pharmacy thing or a PharmD. He told us, Molly, I don't know what PharmD is. But he was willing to give that chance to see if that can be, that can be something worthwhile. So he said, why don't you join us? You do what you want to do and let's see. Now, when I talk to you about the skills a clinical pharmacist needs, a clinical pharmacy professional require when it comes to actual patient care, I don't think any hospital in India, especially in India, teaches that to that extent. Now, he took us up and followed 3 months into appointing me. I think a lot of CVs came, resumes came, and he was thinking to himself, why are there so much rush for a clinical pharmacy post here? And he decided that if they are taught well, they will do well. So he first recruited the first 15 clinical pharmacists as a batch in May 2016, and started to teach us, every night. He is a director, but every night he used to sit with us from around 7 o'clock till 11 o'clock, making sure we learned all the clinical skills that we never learned from our institutions. And that's why we are standing here. Thank you so much, sir. Now, to all the institutions that has put their hearts to our clinical pharmacists to help us develop this whole new arena, this domain, we thank you. So for the students, what we have, our plans is to have a fully functional website as an online platform for you to learn, and we will put out the relevant blogs and whatever useful things that you need in your clinical practice. And we will be having webinars and panel discussions at certain points of time, and we will expand the specialty forums. As I told you, the ID forum is the first thing that we started. We will be expanding it next with the critical care, pediatrics, and so on, till all these specialties as touched upon. And those who are interested to work with us, voluntarily to work with us, we will be giving them a chance to work with our committee, and we'll be conducting annual conferences and workshops for the students. And something that we have to, because in medical field, in any allied healthcare or in any medical healthcare practices that you need, you have to always update yourself with what's happening with every day new papers are coming, new practices are coming. Therefore, it is very essential that we learn from the updated reviews, the updated journals. So we will be having the journal watch, which only highlights what needs to be done, not into a full depth thing, but what needs to be done. And also we'll be publishing our newsletters soon. We will also be having mentorship programs. We will have collaborations with other institutions where people who need a good training facility, we'll choose those training facilities for you, and if you are needed, we will provide you mentorship into this one. So with that, I would like to welcome you to wholeheartedly, for the students, for those who are listening online, all my colleagues, to register to this Federation of Clinical Pharmacy for your betterment, so that we stand as one in making our profession the best one. And thank you once again for listening and for giving us this opportunity to do it. Thank you.
Thank you, ma'am, for sharing this true pathfinding experience.
Psalms chapter 119, verse 130. The unfolding of your words gives light, it gives understanding to the simple. I invite our celebrated dignitaries onto the dais for the lamp lighting ceremony. We acknowledge your presence and thank you all for accepting our invitation and gracing this event.
We invite Reverend Father Sijo Pandappallil, Dr. George Andy Matethra, Mr. K.R. Dinesh Kumar, Dr. Joms.
We also invite on stage Dr. John Villitha, Miss Minnie Sarah Thomas, Mr. Mohammed Faisal, Dr. Grace Mary John, and Dr. Mohammed Hisham for the lamp lighting ceremony. Thank you very much. I request our dignitaries to take their seats. A mentor is someone who allows you to see the hope inside yourself. True mentoring is a brain to pick, an ear to listen, and a push in the right direction. We have the perfect example in this hospital of a mentor and a mentee in this hospital. Professor Dr. George Chandy, the true mentor, and Dr. Grace Mary John, the mentee. George Chandy sir has been the pillar of clinical pharmacy department in BCMCH and has constantly supported all CP activities in the hospital. Sir is the director and CEO of BCMCH, Emeritus Professor of Gastroenterology and Hepatology, the Tamil Nadu Dr. MGR Medical University, and former director of CMC Vellore. Sir has several awards to his credit. He has received the Doctor of the Year award in recognition of achievements at CMC Vellore, Excellence in Education and Christian Leadership in the Medical Art and Sciences of Health and Healing in the year 2007. Sir has received a fellowship by the Australian CMC Vellore Board to train in liver transplantation at the Royal Prince Alfred Hospital, Sydney in the year 1994. To top it all, Sir has to his credit the Dr. B.C. Roy National Award, awarded by the MCI and presented by the President of India for the year 2006 for excellence in leadership in healthcare. Despite all these achievements, I personally would like to glorify Sir for continuing to be the epitome of humility and for being a pious leader. I proudly invite you to deliver the keynote address, sir.
Thank you very much for that introduction and welcome, my beloved Sijo Achan, respected Mr. Dinesh Kumar, Mr. Mohammed Faisal, Doctors Grace Mary John, Mohammed Hanifa, Mohammed Hisham, Mohammed Rashid, Maaman Paul, all my colleagues in the administration, Mr. Biju, all of you who have come, faculty representing various departments, all of you who are part of this huge PharmD family. My request to you is for the next 10 minutes, without thinking what is he talking, I just want you to listen to me and try your best to follow most of what I say. I say this based on difficulties I've had to start liver transplantation in CMC in India, and finally we got to do the first one in 1999. Throughout that period, you will have the naysayers saying stupidity. This is not something for India. You will have people telling you that this particular thing is not necessary. It's just a copy of what the Americans did. So therefore, when you fight all these forces, and when we started our program here, we had the IMA at my throat. We had our doctors thinking that their jobs will go away. All these are just manasila varunna oro chindagala. Unless you get rid of all that, you will never get a big program going. So I'm very grateful to God and to all of you for organizing this. But remember, this is only the beginning. Unless you really go at it carefully, you will get nowhere. That particular year when Grace Mary John decided to do PharmD, she was sent by her parents to Kanjirapalli to study. The idea was that she will study very hard and get into medicine. Somewhere along the way in the month of December, some relatives said there is a better course that has come from America to India, and that is called the PharmD program. Anna dottu paditha nirthi. She just decided, I've got it already, okay? But I'm so glad that she did that for the sake of a huge opportunity for our country. First of all, Hisham and others, I want you to know that people value quality. If you do not have quality in training, if you do not have something that is better than the best, nobody will look at you. Very soon it will die. Colleges are mushrooming all over the country because there is money in it. All of you are willing to pay to get into these courses. So anyone who doesn't pass the NEET, doesn't qualify, will go for the PharmD program. That is not what we want. My first knowledge about this, which I've not told Grace yet actually, is I thought about it only much later. I had a colleague in Adelaide where I worked, and he was the first doctor of pharmacy that I had met, but he was a PhD in pharmacy. But he showed me what can be done in the area of healthcare if you know all these things very well. Now remember, at the end of the day, the patient goes home with a lot of medicines. If the patient does not know what to do with it, if you have not taught the patient what you want to do with it, the whole thing is a farce. It's a mess. So what we did here was to start what is called the farewell program. I'm still struggling with it. Most people think I'm, just overdoing things. But after all the care that we give, if the patient does not take the medicines as advised, if they don't make the changes as required, the whole thing is gone. The patient is not going to gain anything at all. So the role of a clinical pharmacist is huge in terms of understanding the disease, making sure that we do the right things, and follow it up. This is where we have failed. The American system has processes everywhere for everything, procedures for everything. So therefore, even if you don't understand, procedurally you will do right. In India, you have the opportunity to understand, to innovate, to improve on it. But for that, you need people who are committed. And that's what I see here. All of you are committed to this. But my request to you is that commitment should be to quality. And this is where I thank we call her mentee now, she's become the mentor, I think, Grace Mary John, because from the day she joined us, she was totally committed to learning, to understanding. There was one day when I did rounds with her and the patient crashed in front of me. To be very honest with you, I didn't notice it. She picked it up. The patient, right as we were doing rounds, the patient crashed. She picked it up, called everyone, and within 5 minutes we had the patient in the ICU. Other doctors watching, one of them, neurosurgeon, came and asked me, I said, that is the difference. Today I can say that Grace Mary John knows as much as my DIP and B gastro trainees, because over the past so many years, she has not only read, she works extremely hard, and she is there by the bedside. Now this is your problem. Your problem is that you are taught by people who do not understand medical care, health care properly. You need in all these colleges, sir, I will request Dinesh sir, please make sure that the teaching is done by qualified people. Qualified in theory. You have to know, understand the patient. CMC is advantage. All the teaching in not only medicine, nursing, all in the teaching is done by doctors who are seeing patients, they are with patients. And trainees, allied health, nursing, pharmacy, clinical pharmacy, all of them are in the wards with us. The big difference between medicine and other specialties, other areas, is that machines, it will do the same thing. Patients don't. Each patient behaves differently. And unless you see that, unless you know that, you will make mistakes. So you have to be in the ward. Hashim, please stop the clinical pharmacy training in colleges that do not send the students and trainees into the hospital. They have to train in the hospital. Nurses have to train in the hospital. Allied health people have to train in the hospital. No amount of theory will help you. So the quality of training, the quality of care, and how you learn 6 years. What are you doing for 6 years? 6 varsham padichu kazhinjittu, if you do not know how to deal with the patient, what is the use? Secondly, when it comes to drug reconciliation, I would like the clinical pharmacist to be there with the doctor initially interviewing the patient. Because a lot of the problems are created by the wrong use of drugs. You know that. But nobody wants to step in. Nobody wants to correct all this. So the quality of training, the quality of the roles of the person concerned becomes very important. The second is that you have to identify specific roles for people as they train. Specialization is fine. But these 6 years, if you're going to teach 2 years of anatomy by some theorist who teaches without looking at what it does for the patient, those 2 years are useless. You don't need 6 years to get a good clinical pharmacist. 4 years is more than enough, and 1 year of internship is more than enough. Unfortunately, following the American system, again, this has been done here. So the roles have to be identified. The career track has to be identified. What is the career track of a clinical pharmacist for the future? Third, of course, you said networking, extremely important. May I suggest that you try your best to speak to the authority. Why is the Prime Minister talking about Ayurveda as the answer? Why is he? Obviously, they have lobbied with him. You need to lobby and let them know what a clinical pharmacist is capable of doing. When I trained in liver transplantation, my nurse manager, my pharmacist knew much more than me. I'm being very honest with you. As a doctor, I knew very little when I could see the knowledge that they had. And patients would call the nurse manager, not me, though I was in the ward all the time, because they knew here is a person who knows what is happening. So once people know, once the country knows that the knowledge of medicines, the knowledge of the use of medicines, the knowledge of the administration of medicines is with you, nobody will come in your way. But you've got to know, make sure that all those who represent you are taught enough. So the answer to all this is to demand in-service training. That is the key word, in-service training. I try my best to tell all the nursing colleges, please stop this chalk and talk and teaching. Blackboards are not meant to teach you. PowerPoints are not enough to teach you. It has to be on the ground, in the ward, in the hospital, for which all these colleges, see, this is why one of the reasons why we took Nazareth College students here, because they don't have a hospital. How can you have a clinical pharmacy course without a hospital? It's a sin, it's a crime to have a course without a hospital. And all of you have to train in the hospital. I'm sorry for being provocative. I don't mind being quoted. I will stand anywhere and say this. It is a crime to have a college without a hospital to train. So all your training has to be within the hospital. So if you can promise yourself that the quality of care, the quality of training will be exceptional, if you can identify roles within the country for our clinical pharmacists, if you can plan on a career track for them, and the networking along with webinars, classes, sessions, I promise you, I'm sure, within the next few years, you will be a power center to reckon with. So just like the nurses are now wanted everywhere, the clinical pharmacists will be, we call them clinical specialists because we teach them all the clinical skills. But every clinical pharmacist should have the skills. So as Robert Frost says, miles to go before you sleep. This is only the beginning. I pray that God will bless you and take you to much greater heights. Thank you.
Thank you, sir. Kindly stay on the dais, sir. Kindly stay on the dais, sir. I request Dr. Mohammed Hisham to present sir with a memento as a token of our love and appreciation. Thank you very much, George Chandy sir. The previous night when I was preparing the script, I was really wondering what to write, before addressing sir, what to write. And suddenly there's definitely some supernatural power that told me to use the word mentor. And that's how I framed my sentences. And now when I listen to his speech, I realize that he is a man with distinct vision. He is a man, he's a fountainhead of illuminating ideas. And whatever he has told, it's really useful for working CPs like us, and also the interns who have come from different colleges. It's very important to imbibe from his speech that the bedside care is truly important. It's really important to not just go through the theory, but go to the patient and understand the state of the patient. So thank you very much, sir, for that eye-opening speech. Thank you very much.
For our next session, I'm very much delighted to invite Mr. K.R. Dinesh Kumar, sir, our chief guest, a man of principles. He is currently working as Grade 1 pharmacist in Ernakulam Government Medical College. He is also a Kerala State Government nominee as a member of PCI. In addition to this, he holds various posts such as Chairman of DPharm Regulation Committee, Chairman of Hospital and Clinical Pharmacists Welfare and Empowerment Committee, Member of the Public Relation Committee. He has more than 18 years of experience as community and hospital pharmacist in both private and government sector. He previously decorated the posts of Joint Secretary, Hospital Division Executive Member of Indian Pharmacy Association, and I kindly request you to deliver your valuable remarks for us in this event.
ബഹുമാനപ്പെട്ട അധ്യക്ഷൻ ഫാദർ സിജോ പണ്ടപ്പള്ളി, എൻ്റെ ഡോക്ടർ ജോർജ് ചണ്ടി, ഗ്രേസ് മേരി ജോൺ, മുഹമ്മദ് ഫൈസൽ, ഡോക്ടർ മുഹമ്മദ് ഹനീഫ, ഡോക്ടർ മുഹമ്മദ് ഹിഷാം ആൻഡ് മാമൻ പോൾ, മുഹമ്മദ് റാഷിദ്, എല്ലാവരും ആംഗ്ലേയ ഭാഷ സംസാരിച്ചതുകൊണ്ട് തന്നെ കേരളത്തിൽ നിന്നായതും കൊണ്ടും ഞാൻ മാതൃഭാഷ എന്ന നിലയിൽ മലയാളം സംസാരിക്കാമെന്നാണ് വിചാരിക്കുന്നത്. നമുക്കറിയാം, നമ്മളെല്ലാം ഇന്ന് ഇവിടെ ഒത്തുകൂടിയത് 1948 ഇന്ത്യൻ പാർലമെൻറ്റ് പാസ്സാക്കിയ മാർച്ച് 4 തീയതി ഇന്ത്യൻ പാർലമെൻറ്റ് പാസ്സാക്കിയ ഫാർമസി ആക്ട് എന്ന ആക്ട് നിലവിൽ വന്നതുകൊണ്ടാണ്. ഇന്ന് ഫാർമസി ആക്ട് നിലവിൽ വന്നിട്ട് 75 വർഷം പൂർത്തീകരിക്കുവാൻ ഇനി മാസങ്ങൾ മാത്രം ബാക്കി നിൽക്കുകയാണ്. ഇതിനിടയിൽ 2 തവണയാണ് ഈ ആക്ട് അമെൻമെൻറ്റ് വരുത്തിയിട്ടുള്ളത്. ഒന്ന് 1953-ലും ഒന്ന് 1975-ലും. ഈ 2 തവണ ഈ അമെൻമെൻറ്റ് വരുത്തുന്നതിന് വേണ്ടി ഏകദേശം 2 വർഷത്തിലേറെ നമ്മുടെ നേതാക്കന്മാർ പ്രവർത്തിച്ചിട്ടുണ്ട് എന്നുള്ളതാണ് നമുക്ക് മനസ്സിലാക്കേണ്ടത്. അതിനുശേഷം ഓരോ കാലഘട്ടത്തിലും അതിനനുസരിച്ചുള്ള മാറ്റങ്ങൾ ലോകത്ത് ഫാർമസി മേഖലയിൽ ഉണ്ടാകുമ്പോൾ അതിനനുസരിച്ചുള്ള മാറ്റങ്ങൾ നമ്മുടെ രാജ്യത്തും വരുത്തിയിട്ടുണ്ട്. അങ്ങനെ വരുത്തിയതിൻ്റെ ഒരു ഭാഗമാണ് 20-ാം നൂറ്റാണ്ടിൻ്റെ അവസാന കാലഘട്ടത്തിൽ ലോകത്ത് ക്ലിനിക്കൽ ഫാർമസിസ്റ്റ് എന്ന ഒരു വിഭാഗം ഉയർന്നു വന്നപ്പോൾ നമ്മുടെ രാജ്യത്തും ആ കാലഘട്ടത്തിന് തുടർന്നുള്ള കാലഘട്ടം വന്നപ്പോൾ ഹോസ്പിറ്റൽ ആൻഡ് ക്ലിനിക്കൽ ഫാർമസി എംഫാം എന്ന് പറയുന്ന ഒരു വിഭാഗം ഉണ്ടാവുകയും അതിൽ നിന്ന് വീണ്ടും ഇത് കുറച്ചുകൂടി ഈ ശാസ്ത്രലോകം വലുതായിക്കൊണ്ടിരിക്കുകയാണ് എന്നുള്ളതിൻ്റെ ഘട്ടത്തിൽ വന്നപ്പോൾ 2006 58ാമത് ഇന്ത്യൻ ഫാർമസ്യൂട്ടിക്കൽ കോൺഗ്രസ് ബോംബെയിൽ നടക്കുമ്പോൾ അന്നത്തെ ഫാർമസി കൗൺസിൽ ഓഫ് ഇന്ത്യയുടെ പ്രസിഡൻ്റായിട്ടുള്ള ശ്രീ ബി സുരേഷ് അത് പ്രഖ്യാപിക്കുകയായിരുന്നു. അങ്ങനെ 2006 പ്രഖ്യാപിക്കുകയും നമ്മുടെ സംസ്ഥാനത്ത് 2008 ഈ ഫാം ഡി കോഴ്സ് ആരംഭിക്കുകയും ചെയ്തതാണ്. വേണ്ടത്ര വളർച്ച നമ്മുടെ മേഖലയിൽ നമ്മുടെ രാജ്യത്തുണ്ടോ എന്ന് ചോദിച്ചാൽ ഡോക്ടറെല്ലാം സൂചിപ്പിച്ചതുപോലെ തന്നെ 2008 തുടങ്ങി 6 വർഷം നീണ്ടു നിൽക്കുന്ന ഈ കോഴ്സ് അന്ന് ഇന്ത്യയിൽ ഈ കോഴ്സ് ആരംഭിക്കുമ്പോൾ ഫാർമസി കൗൺസിൽ വിഭാവന ചെയ്തത് പ്രധാനമായും നമ്മുടെ ഫാർമസി വിദ്യാർത്ഥികൾ കോഴ്സ് പൂർത്തീകരിച്ച് പുറംനാടുകളിലേക്ക് പോകുമ്പോൾ 3 വർഷത്തെ കോഴ്സ് നല്ല 4 വർഷത്തെ കോഴ്സിന് അത് 5 വർഷത്തെ കോഴ്സോ 6 വർഷത്തെ കോഴ്സോ ആക്കിയാൽ മാത്രമേ അതിന് കൂടുതൽ പ്രാധാന്യം മറ്റു മേഖലകളിൽ ഉണ്ടാകുള്ളൂ എന്നുള്ളതിൻ്റെ അടിസ്ഥാനത്തിലാണ് ഈ 6 വർഷത്തെ കോഴ്സായിട്ട് ഇതിനെ മാറ്റിയെടുത്തത്. ഫാർമസി ഫാം ഡി കോഴ്സ് യഥാർത്ഥത്തിൽ ക്ലിനിക്കൽ സൈഡിലാണ് ഏറിയ സമയവും പ്രവർത്തിക്കുന്നത് എന്നുള്ളതാണ്. അങ്ങനെ ഇല്ലാത്ത ഏതെങ്കിലും സ്ഥാപനങ്ങളിൽ നിന്ന് പുറത്തിറങ്ങുന്നവരാണ് ഒരുപക്ഷെ ഫാം ഡിക്ക് ജോലിയില്ലാതെ പോകുന്ന ഒരവസ്ഥയിൽ ക്ലിനിക്കൽ ഫാർമസിസ്റ്റുകൾ മാറുന്നത്, മറ്റിതര മേഖലകളിലേക്ക് തിരഞ്ഞെടുക്കപ്പെടേണ്ടത്. എല്ലാ അത്തരത്തിൽ മുഴുവൻ സമയ ക്ലിനിക്കൽ ഒരു ഹോസ്പിറ്റൽ മേഖലയിൽ പ്രവർത്തിച്ചു കൊണ്ടുപോകുന്ന അല്ലെങ്കിൽ ഹോസ്പിറ്റൽ മേഖലയിൽ കൂടുതലായി ചെലവഴിക്കപ്പെടുന്ന എല്ലാ വിദ്യാർത്ഥികൾക്കും അവരുടെ കോഴ്സ് പൂർത്തീകരിക്കുമ്പോൾ അവരെല്ലാം തന്നെ നല്ല നിലയിലേക്ക് പോകുന്ന ഒരവസ്ഥയാണ് നമ്മുടെ സമൂഹത്തിൽ നമുക്ക് കാണാൻ കഴിയുന്നത് എന്നുള്ളതാണ്. ഫാർമസി കൗൺസിൽ ഓഫ് ഇന്ത്യയും അത്തരത്തിൽ തന്നെയുള്ള നിലപാടുകളാണ് സ്വീകരിച്ചിട്ടുള്ളത്. ഫാർമസി കൗൺസിൽ ഓഫ് ഇന്ത്യ ഇപ്പോൾ ഈ പറയുന്ന ക്ലിനിക്കൽ ഫാർമസിസ്റ്റിൻ്റെ പോസ്റ്റ് തന്നെ രാജ്യത്ത് സർക്കാർ സ്ഥാപനങ്ങളിലടക്കം ഉണ്ടാക്കണമെന്നുള്ള നിർദ്ദേശങ്ങളുമായിട്ട് നിരന്തരമായി മിനിസ്ട്രി ഓഫ് ഹെൽത്തിൽ ബന്ധപ്പെട്ടുകൊണ്ടിരിക്കുകയാണ്. അതിൻ്റെ ആദ്യ പടി എന്ന നിലയിൽ തന്നെ ഓൾ ഇന്ത്യ മെഡിക്കൽ സയൻസിൽ ഒരു പോസ്റ്റ് ക്ലിനിക്കൽ ഫാർമസിസ്റ്റിന് ഉണ്ടാക്കുന്നതിന് വേണ്ടിയുള്ള തയ്യാറെടുപ്പുകൾ ആയിക്കഴിഞ്ഞു എന്നുള്ളതാണ് അതുമായി ബന്ധപ്പെട്ട് സൂചിപ്പിക്കുവാനുള്ളത്. എന്തായാലും ഈ മേഖലയിൽ ക്ലിനിക്കൽ ഫാർമസിസ്റ്റ് എന്ന വിഭാഗത്തിൽ അവരുടെ വിഭാഗം മാത്രമായി കേന്ദ്രീകരിച്ചുകൊണ്ട് ഒരു സംഘടന ഇല്ലാതിരുന്നു എന്നുള്ളത് ഒരു സത്യം തന്നെയാണ്. ഓരോ സംസ്ഥാനത്തും ചെറിയ ചില പോക്കറ്റുകളിൽ മാത്രമാണ് ഇത്തരത്തിലുള്ള സംഘടനകൾ ഉണ്ടായിരുന്നത്. പക്ഷേ ആ സംഘടനകൾക്ക് ഒരു കൂട്ടുയോജിപ്പുകൾ ഉണ്ടായിരുന്നില്ല. പലപ്പോഴും പേരൻസ് അസോസിയേഷൻ എന്നെല്ലാം പറഞ്ഞ പേരിലാണ് ഈ ഫാം ഡി അസോസിയേഷനെ പുറത്ത് നമുക്ക് കാണുവാൻ കഴിയുന്നത്. എന്നാൽ അതിൽ നിന്നെല്ലാം വ്യത്യസ്തമായി നമ്മുടെ ഈ മേഖലയിലെ എല്ലാം കൂട്ടിയോജിപ്പിച്ചുകൊണ്ട് കൂടുതൽ ഉത്തരവാദിത്വത്തോടുകൂടി കൂടുതൽ ട്രെയിൻ ചെയ്തുകൊണ്ട് ഈ മേഖലയെ നമ്മുടെ രാജ്യത്തും അതുപോലെ തന്നെ ലോകത്തും ഒരു വലിയ വിഭാഗമാക്കി മാറ്റുന്നതിന് വേണ്ടുന്നുള്ള ഒരു തയ്യാറെടുപ്പിൻ്റെ ഭാഗമാണ് ഇന്ന് നമ്മളിവിടെ ഒത്തുകൂടിയിട്ടിരിക്കുന്നത്. ഈ ഒത്തുകൂടലിന് അതിൻ്റേതായ ഒരു ബാല്യകാലവും നമുക്കറിയാം. ഒരു കുട്ടി വളർന്നു വരുമ്പോൾ ആ കുട്ടിയുടെ ഓരോ ഘട്ടങ്ങളെ സംബന്ധിച്ചും ബാല്യകാലത്തിൽ ഉണ്ടാകുന്നതല്ല അതിൻ്റെ ശൈശവത്തിലേക്ക് വരുമ്പോൾ, അതിൻ്റെ യുവത്വത്തിലേക്ക് വരുമ്പോൾ. അപ്പോൾ സ്വാഭാവികമായും ഒട്ടനവധി പ്രതിസന്ധികളെയും പ്രതിബന്ധങ്ങളെയും നേരിടേണ്ടി വരും. ആ നേരിടേണ്ടി വരുന്നതെല്ലാം തന്നെ നമ്മൾ സമഗ്രതയോടുകൂടി വളരെ ശുഷ്കാന്തിയോടുകൂടി ഇന്നുണ്ടാകുന്ന ഈ ആവേശം തുടർന്നും ഇതേ തരത്തിൽ തന്നെ ഉയർത്തിക്കൊണ്ടുവന്ന് ഈ മേഖലയ്ക്ക് ഉതകുന്ന തരത്തിലുള്ള ഒരു പ്രവർത്തനത്തിലേക്ക് പോകുവാൻ ഈ സംഘടനയ്ക്ക് കഴിയുമാറാകട്ടെ എന്നാണ് ഈ അവസരത്തിൽ ഇതുമായി ബന്ധപ്പെട്ടുകൊണ്ട് സൂചിപ്പിക്കുവാനുള്ളതും ആശംസിക്കുവാനുള്ളതും. നമ്മുടെ രാജ്യത്ത് തന്നെ ഈ ഇത്തരത്തിലുള്ള മറ്റു ചില ഞാൻ മുമ്പേ സൂചിപ്പിച്ചതുപോലെ ചില പോക്കറ്റ് സംഘടനകൾ വളരെ വലിയ മോശമായ രീതിയിൽ ഈ മേഖലയെ തന്നെ മോശമാക്കുന്ന രീതിയിലുള്ള ചില പ്രവർത്തനങ്ങൾ സംഘടിപ്പിക്കുന്നുണ്ട്. അതിനെയെല്ലാം തന്നെ നിങ്ങളുടെ ഈ സംഘടനകൾ കൊണ്ടാണ് ഫെഡറേഷൻ ഓഫ് ക്ലിനിക്കൽ ഫാർമസിസ്റ്റ് ഓഫ് ഇന്ത്യ എന്ന സംഘടന അതിൻ്റെ എല്ലാ ആ പോരായ്മകളെല്ലാം നികർത്തിക്കൊണ്ട് ഒരു വലിയ മഹത് പ്രസ്ഥാനമാക്കി മാറ്റുന്നതിനുള്ള പ്രവർത്തനങ്ങൾ ഏറ്റെടുക്കാൻ കഴിയണം എന്ന് മാത്രമാണ് ഈ അവസരത്തിൽ ഓർമ്മപ്പെടുത്തുവാനുള്ളത്. ഇവിടെ വന്നിരിക്കുന്ന മുഴുവൻ വിദ്യാർത്ഥികളെയും അതുപോലെ തന്നെ ഫാക്കൽറ്റിയെയും ഈ മാനേജ്മെൻറ്റിനെയും അതേപോലെ ഇതുമായി ബന്ധപ്പെട്ട് പ്രവർത്തിച്ച മുഴുവൻ ഫാർമസി സുഹൃത്തുക്കളെയും ഒരിക്കൽ കൂടി അഭിവാദ്യം ചെയ്തുകൊണ്ട് ഈ സംഘടനയ്ക്ക് എല്ലാവിധ ആശംസകളും നേർന്നുകൊണ്ട് നിർത്തുന്നു. നന്ദി, നമസ്കാരം.
സർ, ഒരു മിനിറ്റ്. ഇത്രയും നേരം ഫാർമസിയുടെ നടവഴികളിലൂടെ ഞങ്ങളെ ബോധവാന്മാരാക്കിയതിന് താങ്കളോട് നന്ദി പറയുന്നു. മിസ്റ്റർ മുഹമ്മദ് ഫൈസൽ സർ, ഇഫ് യു കുഡ് വെനറേറ്റ് അവർ ചീഫ് ഗസ്റ്റ്.
experience and has several research publications in both national and international peer-reviewed journals. Moreover, he is a recipient of Eminent Pharmacist and Distinguished Alumni Award from Farooqiya College of Pharmacy, Mysore, for the lifetime contribution made to the profession of pharmacy as an academician, researcher, and administrator. In addition to this, sir is the life member of Association of Pharmaceutical Teachers of India, Indian Hospital Pharmacists Association, Indian Pharmaceutical Association, and Kerala Pharmacy Graduates Association. Furthermore, he is the executive editorial board member of Asian Journal of Pharmaceutical and Health Sciences. Sir has been recently elected as the president of Kerala branch of Association of Pharmaceutical Teachers of India. Sir was unable to make it to this venue due to prior engagements, but he will be gracing us with his.
Respected dignitaries, dear clinical pharmacists across the globe, ladies and gentlemen, a warm good morning to one and all. At the outset, let me thank the organizers of FCPI launch program for inviting me to be a part of this historic event. As we all know, the Federation of Clinical Pharmacists in India is a professional organization which consists of clinical pharmacists from India who are engaged in serving the society across the globe. They are also actively engaged in supporting the young budding clinical pharmacists to learn better by translating theoretical knowledge to best clinical practice. Even though the master's program in pharmacy practice was introduced in India during mid-90s, the introduction of PharmD course in 2008 has created a positive change in clinical pharmacy profession in India. In 2010, 3 colleges in Kerala started PharmD course, and many people, including pharma professionals, were skeptical about the future of this program. Many teachers were dubious about the scope of this program in India. But after a decade, the entire scenario has changed. Clinical pharmacists are now playing a vital role in healthcare system. Now, a dedicated group of clinical pharmacists have joined hands to support new generation pharmacists, thereby playing a crucial role in pharmacy education, patient care, and research. As a teacher and as the president of FCPI Kerala State Branch, I extend our wholehearted support for all the future activities of FCPI, especially the initiatives to support the young budding clinical pharmacist. Once again, I thank all the organizers of FCPI, especially Dr. Grace Mary John and Dr. Maman Paul for inviting me to this program. I wish and pray that let your efforts to uplift the profession of pharmacy be a new chapter in the history of the clinical pharmacy in India. Once again, thank you all, love you all, Jai Hind.
Thank you, sir. Now comes the most awaited event of the day. Our ambitious forerunners have launched a brand, and now it's time for brand building. I call upon the stage Dr. George Tandi sir and Mr. K.R. Dinesh Kumar for the official launch of FCPI logo and website.
ദിനേശ് സാറിൻ്റെ കൂടെ ഈ ഒഫീഷ്യൽ ലോഗോ ആൻഡ് ദ വെബ്സൈറ്റ് ലോഞ്ച് ചെയ്യാനായിട്ട് വി ആർ വെരി പ്രിവിലേജ്ഡ് ആൻഡ് ഐ തിങ്ക് ഇറ്റ്സ് പീപ്പിൾ ലൈക്ക് മിസ്റ്റർ ദിനേശ് ആൻഡ് അതേഴ്സ് ഹു ആർ ഗോയിങ് ടു ഗെറ്റ് അസ് ഇൻ ടു എ മച്ച് ഹയർ പ്ലെയിൻ അല്ലേ സർ? സോ വി ഹാവ് ഗ്രേറ്റ് പ്ലെഷർ ഇൻ വിത്ത് ബോത്ത് അവർ ഫിംഗേഴ്സ് ഞങ്ങൾ പ്രസ് ചെയ്യും. I want to thank Maman and others who have been working very hard. വേറെ പണിയൊന്നും ചെയ്യാതെ ഇത് തന്നെ ചെയ്തുകൊണ്ടിരിക്കുകയായിരുന്നു ഒരു മാസം.
Thank you very much, sir.
I know that all of you are curious to know what our educational platform is going to provide us. And we have the right person available to explain this to us. We all know the voyage of a CP is not easy, and he is the inspiration for us to strive forward. Yes, he's our Dr. Mohammed Hisham. He currently works as clinical pharmacist at Cleveland Clinic, Abu Dhabi. He holds 2 American Board Pharmacy certification, both in critical care medicine and infectious disease. He also leads the emergency pharmacist services along with unit-based pharmacists on Heart and Vascular Institute acute care floor. To add furthermore, he holds the position of clinical assistant professor in Department of Medicine in Cleveland Clinic Lerner College of Medicine of Case Western Reserve University, Cleveland, Ohio, USA. He's also a clinical lecturer and advisory board member for Masters in Clinical Pharmacy at Gulf Medical University College of Pharmacy, and is a member of advisory board member of Amrita School of Pharmacy. He is the preceptor for CCAD postgraduate 1-year pharmacy residency program accredited by ASHP. He won the award for Best Preceptor for CCAD Pharmacy Internship Program in 2018. He also received the Young Intensivist Award for the Best Innovative Research Paper in Criticare 2016 at Agra. There is an extensive list of achievements that I could mention here, but without wasting even a second, let's invite Dr. Mohammed Hisham, one of the founding directors, onto the stage.
Very good morning to all. I first of all would like to thank everyone who's present online and offline, and it's excitement for all of us, and it's a privilege to be here and to share what we have been planning for so long, and what is the plans for you to what's the plan for you to get in the subsequent days. So let me start off with introducing the ID Forum team. So this is the Infectious Disease Forum team. You have 10 members in the list, and just like echoing what Grace has mentioned before, all of these people, not only the ID Forum, we have multiple other forums coming up in the pipeline as well, but the members, all of them are like-minded people who are like voluntarily into this apart from their current jobs or positions wherever they are. So we had 2 options. One is be satisfied with the job we have and continue with what we're doing, or voluntarily along with the job give back to our society and the students for uplifting the profession in our country. So whoever's volunteered and whoever is a part of this forum, not only this forum, the whole platform has voluntarily been a part of it, and all these people are like-minded people. And I would like to specifically mention all of these people, it's 0 egos in the team. So there is nothing between, like, if I have anything, I could share it with the team, and if they tell me I need to improve any of these things, I would definitely take it as like constructive feedback for me to improve. That is the best part of this team. That is why, as Sir has mentioned, we would be able to we're trying to make it to give you the high quality content which would be available on our website and platforms. Let me introduce the team. So we have Ajmal and Sijo. Both of them were clinical pharmacists in Astra MIMS. Currently they're working in UAE. We have Fatima Shameen. She is working as a clinical pharmacist in Amrita Institute of Medical Sciences. I'm sorry. We have Grace, Mary John, and myself, who we've already been introduced. We have Saidulu and Saili Gaur, who's currently working in PD Hinduja in Mumbai. We have Sangeeta Sudhir, who is also a clinical pharmacist from Amrita Institute of Medical Sciences. We have Selva Bala, who was working in Coimbatore, currently practicing in the United Arab Emirates. And we have Vrinda Nambudri, who is also practicing as a clinical pharmacist in Amrita Institute of Medical Sciences. So this is the team which consists of ID. It is the team which consists of ID specialists around who has been graduated from the country and is practicing in parts of the country as well as outside the country. So with this team, how we've done is to put quality materials or contents available for all of you guys. We've networked together. We put a folder in such a way that the review process of any content which is prepared is being done multiple times. It's more tedious, and different people do a detailed review, and the references have been shared with different people, and whoever is doing the presentation does not like, the presentation is done by the person, but a lot of inputs have come from the team, the whole team. So that is how we are able to produce high quality contents. And to share the excitement, I'm just introducing what we've prepared for you in the coming right after launch. One of the first webinars would be on 5th of October. So this is what we planned, is to prepare a basic module of infectious disease. It would be very basic from a clinician point of view. It won't be like the microbiology you read it from books. So clinicians, like clinical pharmacists, would be presenting topics. How is the clinical application of all of these topics into practice, and how we can bridge the gap between what has been the foundation for you in the books to what is being there in practice. So you would be getting it from a perspective of a clinical pharmacist. It won't be like a microbiology, gram positive, these are the list of organisms, gram negative, these are list of the organisms. How identifying the the microbiology is important in a clinical setting, those would be discussed. So try to go through all of these modules. How frequently we are planning to do this is one presentation every 10 to 14 days, which gives you ample time to go and read or like review the contents, and also go through the references. So what we planned is a basic module in infectious disease, which covers almost all the basic topics in microbiology with its clinical applications. And subsequently we have the activity spectra, which includes the antimicrobial agents and the microorganisms, followed by pharmacokinetics, antibacterial and antifungal, TDM, as well as penetration of antibiotics in different body sites. So remember, all these contents are will be available free, and it would be live on the website. So you could also interact with these clinical pharmacists by asking questions. And again, if you couldn't attend the session live, you could go back, attend, and drop us emails. So this is free does not mean that we've compromised the quality of the content. The ID forum members I've shown is very skilled and talented. So why I would say is, like, we've spent individually for our professional development, we spent money for getting certified and like getting trained in all of these aspects, and we've put that effort to replicate it, to give it to you guys so that it's available for free. So that is the purpose. So all these are free, but all these would cost you much more if you, like, say for example, we have people in our forum who are SIDP certified, like Society of Infectious Disease Pharmacists certified. They have a module in which it covers all in details. We have people who are board certified. We have people who've been trained in ID in different parts of the country and outside the country. Also, we have people who've done other certifications and massive online programs, and they are all a part of this. Collectively, as a team, we've put the contents together, and it's not the individual who's been doing the content, it is the team who's put that contents together, reviewed by the whole team. All these might have cost the individuals for their professional development, say for example $750 to $1,500 for each of these certification programs, but all of these we've made sure that we give back to our society, and our students, whoever is in practicing clinical pharmacy, they get it for free, and they are up to that mark, so that we don't have to worry that the resource is a problem. So that is one thing which we made sure, and you'll have to make use of it because a lot of effort has been put for preparing these contents. So whatever slides and contents I've just showed, the list of contents is already ready. So we have all of these ready, and some of them on the final stages of review. So it's not like something which we are going to do afterwards. It's all set, it's all ready. It's just we would be doing over a period of time of in a frequency of one presentation every 10 days for 2 weeks. So that is the plan. And remember, make use of this, and you would be definitely, you can reach out to us by asking questions through the website or through emails, and a lot of effort has been put, so try to utilize that. It should not be one other resource which is available for free. but it should be a resource which would benefit you, and this could be applied on your clinical practice. Does not have to be that I'm not a clinical pharmacist. It is there for practitioners at any level, a beginner, intermediate, and an expert. So what we planned is a basic module followed by an advanced module, then going on to specific disease, the site-wise infections like neurology, cardiovascular infections, pulmonary infections, things like that. This is particularly for the infectious disease forum. Subsequently, when we launch the other forums, the plan is the same: basic modules, advanced modules, and we're trying to build it in such a way that your base is fine. You come and ask us, where do you study? We tell you, go back to our platform, go through the basics, advanced, and then come. Whatever events we plan subsequently is based on the basics. So anyone who wants basics, you have it from a clinician point of view, in a different perspective of thinking. It won't be like a regular theoretical point of view. It will be from a practical aspect. So that is one part of it. Excited to share this information, which was already been shared before. We will be collaborating with Believers Church Medical College to host an international conference specifically for clinical pharmacists in infectious diseases. So that is the most exciting part which we've planned for. We've sat together as the members of the ID forum, and people from the Believers team have sat together to put together a good scientific program and like to make it very useful for people practicing at each level. So the plan is such a way that when you start completing the basic modules, you're ready for the conference. That is the plan. So the conference would be for each level, but make sure that you attend the basic modules so that when you attend the conference, it should be like a built up for the conference and you are well understood and ready for the conference to understand it better. So remember, it's not everything. It is a way in which you can get information to people who are passionate and want to excel in your career, can make use of it to take your career to the next level. So it may have information which you would need more reading in it. It does not mean that it has everything. It would have to a very good perspective of understanding and people you can interact with. Along with that, you will have additional readings which you'll have to do by yourself, and people will be there who you can reach out to and discuss all those things. So something interesting about the international conference which we are planning is we have a pre-conference workshop which will be limited with limited registration, and the plan is it won't be like a normal workshop where people talk and go. It will be a workshop where you will be given homework to do it before, and in the workshop itself we'll be giving you things like to do how to do things along as a team and to and its implications in the institution and try to applying it practically. So along with that, you'll also have follow-up as well, so that we don't lose the touch. We have to see how the workshop and the conference has benefited you. The workshop would have, it's why it's limited is we are looking at crowd of people who are going to make use of it, do a reading, pre-reading, and during the workshop they make use of it, and after that they do subsequently go back and apply this in the practice as well. So along with that, we have a 2-day conference which is followed by the pre-workshop. Tentatively, it's planned in 3rd week of Jan 2023. We have speakers, international and national ID physicians and ID clinical pharmacists specifically. And we would also have poster presentations as well. So make sure that you stay tuned in our social media and in the website so that you get more updates of all of these educational contents you're going to get from the Infectious Diseases Forum in the beginning. Subsequently, after the forum, what we planned is we're planning for an virtual infectious disease week. That is 1 whole week of infectious disease, topics related to infectious disease. It would be in the evening hours, like 4:35, 2 hours, 2.5 hours maximum, with a session, like 2 or 3 sessions with active discussion. And that would be over a period of 1 week. And this would also have international speakers and national speakers, physicians, ID physicians, and ID pharmacists as well. And you would be able to interact with them because it would be live. And this is the plan from the ID forum so far. And I would like to thank the whole team and the people supporting us. advisory board as well, because a lot of inputs from different people has made this possible. It's not one individual effort, it is a team effort, and hats off to the whole team and people who are supporting us, because it's something which is not small, it's huge, but to make it applied and make it into practice and deliver it is the most important thing. So far what I've told is the basic module is ready. That itself was very, by reviewing the slides, I would definitely want to say those are high quality contents which has been prepared, and I'm sure if you make use of it, you would go to the next level of practice, because it is important to change the way in which we think. So that is very important. So it's not like it was done by my senior like this, I would follow the same. So, or I was taught like this, I'm going to change. So it is the way in which you change your perspective of thinking which would help you take you to the next level. So that is what our efforts are. The gaps which we felt could have been done better is what we are trying to give it back to you. And it would be like, it is not a replacement of what the foundation which has been done by colleges. It is trying to bridge the gap between what you could achieve even better if you get trained and you are well equipped when you come to the job market, and you should be standing out by, so that is the aim of all this. That's why whole effort has been put by the whole team to do this. So thank you so much, and I'm really excited for that as well.
Hisham, with the permission of Reshma and Shireen, I'll break protocol because I could feel the passion with which you spoke. My requests are three. One, when you do this, can you make it a certification program? That means everybody does the exams and all that. That's my first request. Second request is, you said you'll allow others also to come in. Can you allow medical doctors also to be part of this? Because we learn a lot from it, and we might find that we learn right now. Dr. Grace does much better than all of us in the ID area, like you do with Cleveland Clinic. The third request is, if it is possible, this is what is happening in the Medical Education Forum. A lot of what is being taught from outside, the Byju's type of teaching, is getting incorporated into the regular teaching stream. So if this becomes a regular part of the classes as well, I don't know how it can be done, but it may be something that you can offer so that all of you who are very good at this would become teachers nationally. Exactly. So these three thoughts I just wanted to leave with you.
Thank you so much, sir.
Thank you, sir.
I would like to add something what sir was telling. So what we've planned is in such a way that the people from different institutions would be able to use this, and they would be in a website. When Maman goes through it, our website would have tracker in such a way that people, that is in progress. So in such a way that how much people have completed the course, based on that attendance after they complete it, they would be able to get the certificate after the completion. And again, it would be even attendance would be there, and the whole course would be like if they want to get like an after evaluation proper completion, that would be done only after evaluation, a certificate would be done. That's in the pipeline. And to add to this, definitely it's an open platform. You just have to log in. It's free. Anyone can be a part of it by freely logging in, which it's available from the website. And by logging in, the advantage is it is also available on YouTube, but by logging in, the advantage is that you are able to track individually. We are also able to track as a team that what content is being given, how much people are viewing it, which is like what is the trend, what people want more. So to add to all this, whatever information what Grace has mentioned, all of those, so the slides won't be like normal theoretical class. So it would be it would have a bit of basic information, case presentation, like you would have a case scenario coming through. If there is anything which is like recent studies or publications related to this thing, it comes in between. Along with that, we'll also have trials and other articles related to that. It won't be like a regular theoretical class. It would have cases, it would be interactive, application-based questions would be there in the slides. It would have like anything like recent studies based on some drugs or comparative disease condition-wise. That will also be included in the slides. and how you can make use of it. So it's there for all learners. So you are a student, does not matter. You are practicing at beginner level, intermediate, or advanced level. It will have things for everyone, because it is more than the slides. It's the information you get by reading the references, which will be given followed up as well. So all of this, along with multiple things which Grace has mentioned as the plan, would be there and useful for all, so that you are in par with the practice, and you don't have to, when you come and join after 1 year, 2 years, you don't have to think, okay, this is one study which happened 2 years back, I was not aware of that. You would be in par when you follow these things. So that is what the journal watch and all is meant for. And that would, again, journal clubs would be there, present by people, but all of this would be there in par on the system, so that you are abreast with all the information which is there. Thank you so much.
Selfless efforts by this team without expecting monetary benefits to reach aspiring CPs is laudable. Thank you so much for providing us this platform. May this platform be a bridge between theoretical and practical knowledge for us. Thank you so much, and we hope to be a part of this organization.
Next, I would like to call on stage Dr. Maman Paul, FCPI Joint Secretary, Clinical Pharmacist, Telemedicine Coordinator, and Web Architect, to guide us through the FCPI website navigation. A digital technology enthusiast like him will be best fit for this role.
Good morning, dignitaries present here, watching online, my colleagues, and dear students. So I will be taking you through the website, how to use it to its full potential, and how it will be beneficial for you. So right after you log on to www.fcpi.in, you will be seeing a page. On the right upper hand, there will be a Join FCPI button. And once you click on that button, you will be able to register onto our platform, which will be also beneficial for us to help you and to guide you and to provide different content that we are preparing in the background. And these content will be shared with you through the email address and the WhatsApp number that you provide. We are in the pipeline to also provide the information through the WhatsApp as well. So moving on to the next phase, there will be on the right upper hand, there will be a menu button on which it is mentioned the specialty forums, about us, events, blogs, and contacts. All of which are right there to access for your easy access. While scrolling down through the home page, you will be able to see the recent updates and the upcoming events, which are part of our organization, which we will be providing from the back end, and you will be able to access it right from the home page. And in this upcoming events, the basic module for the infectious disease will be available on 5th of October. And you will be able to use, log on to it, the website from here itself. Then the other thing that we are focusing on is to provide you with an academic calendar that will have the different plans that we are having in the coming, that are in the pipeline. So if you are interested in infectious diseases, to give you an example, there will be a microbiology class that will be coming up on 5th of October. There will be another session that will be coming up on 8th of October. So likewise, you yourself will have a proper plan of how best you will be able to use the website and how best you will be able to access the classes, and you will be also provided with a backend once you log in. You will be also provided with a backend that will have as Dr. Hisham said, the updates that are there, the classes that you have taken, the CME points that you have gained from that, and also you will be provided with a certificate that you will be able to use while you are progressing in your career. So as a whole, this whole platform will be beneficial for you. This was the prime aim right from the beginning of the discussion in the start of the Federation. So at the initial period itself, we wanted this whole platform to be a digital first process, so that everyone across the globe and in the country, to be specific, will be able to access the content easily and will be able to learn from us. So as I mentioned earlier, there is the calendar, which is the academic calendar that you can access from here. And then scrolling downwards, you will be seeing the blogs and the latest updates. Blogs and the newsletters that we will be updating on a regular basis. So in the blog session, there will be, as mentioned earlier, from the different specialty forums, you will be having updates regarding different trials, different clinical practice updates, and practice changing updates that are there, that are coming up on new articles that are coming up, will be published through these sections. So this is the most important aspect that we are focusing as a federation. Like as our earlier speakers mentioned, we are having specialty forums. And the first one we are starting with is the infectious diseases. And moving forward, we will be having other specialties added on this platform. And you can access those content from the website as well. And once you click on that, you will be forwarded to a page that will be having this, you will be able to go to a specific page that is dedicated for that forum. The advantage with that is the blogs and the updates that are coming there are specific to that specialty clinic. That is, if you are interested in a particular specialty forum, then you can use this specialty forum and find out the blogs that are there for that particular forum. So likewise, all the updates that are coming there, you can access. But the other thing that I want to mention here is that you will be some content, for accessing some content, you have to log into the platform, and that is for us to update you with more clinical contents that are coming in the coming months. So if you are facing any difficulty while you are using this specialty forums, or for any other clinical updates, or for any other help that you need, you can also use the contact section at the top right corner to send us a message through that. And we have delegated people to look at those messages and to help you and to reply to those messages specifically. So with this, I conclude my brief session on how to use this website for the best use case scenario. Thank you.
Thank you very much, Dr. Maman Paul. This effort is huge. I understand that the back-end efforts are huge. It's way more than what we perceive. And I really want to say that this requires true appreciation. These selfless efforts require true appreciation. So let's all give the whole team a big round of applause, and a big round of applause for Maman Chetan for backing, helping us, the technical tech geek. Thank you very much. Next, we would like to hear some honest wishes for our new venture from people who have gone a long way to support and guide us in our clinical pharmacy training programs. I invite on stage Dr. Jomsi George, Medical Superintendent of BCMCH. Sir has constantly strived to bring clinical pharmacists to the forefront in order to deliver pharmaceutical and patient care. Over to you, sir.
respected Director Dr. George Addy sir, Dr. Grace Mary, KP Mohammed Hanif sir, KR Dinesh Kumar, Mohammed Faisal, Mohammed Hisham, Maman Paul, Mohammed Rashid. It's a proud day today, a history in its making. The day which you all will look back and cherish. I'm pretty sure of that. 6 to 7 years back, I remember the day when Dr. Grace came to our hospital, and our director, he was spending time to understand what pharmacy, PharmD is all about. And I could see a lot of, മനസ്സിൽ ലഡ്ഡു പൊട്ടി എന്ന് പറയുന്ന പോലെ ഒത്തിരി കാര്യങ്ങൾ സാറിൻ്റെ മനസ്സിൽ കൂടെ പോവുകയും. And he took Grace on board, and it was a time when we had a lot of shortage for junior doctors, because junior doctors are a group of people which is the main force who works all around in the hospital, but their preference is to get PG and go. So when the entrance comes, there will be acute shortage, and we were looking at possibilities of how a clinical pharmacist, a PharmD graduate, can also be part of the team. So there was a lot of interview, and Sir had a vision of getting a lot of people on board. And as usual, there was a lot of resistance also from a lot of people, especially the doctors. How can they wear steth? How can they see patients? How can... And I could see how that man stood strong and said, I even asked once, Sir, നമുക്ക് അങ്ങനെ ഒരു ഇതിൻ്റെ യുദ്ധത്തിലോട്ട് പോകേണ്ട ആവശ്യമുണ്ടോ എന്ന് ചോദിച്ചപ്പോഴും സാറ് പറഞ്ഞു, മോനെ, there is a lot of people, they are struggling to get jobs. There are a lot of qualified people amongst us who are not ending up anywhere. I would like to help them. With that note, he, the pharmacist, clinical pharmacist, started coming into our hospital, and we could see the difference. Slowly, the doctors, all the healthcare professionals started accepting them, and the difference they made in the hospital healthcare, the difference in the lives of the patients was very evident. One of the proudest moments for me, I had a lot of MDs in my department. They used to do the cancer screening talks for the community. They used to be part of the cancer screening. They used to be part of the clinical care services. They used to be, now we have them in chemotherapy mixing also. And one of the proudest moments for me was when one day one of my patients came, and one patient was getting out, and they were standing and showed me hi like this. I said, ha, കാണാൻ വന്നതാണ്. അല്ല, ഞാൻ മറ്റേ നമ്മുടെ ഫാമിലി ഡോക്ടറിനെ കാണാൻ വന്ന കണ്ടു, ഞാൻ പോവാ എന്ന് പറഞ്ഞു. So that was a great, to see the acceptance which has come about, and the mentorship which our director was able to give. Nights and nights I could see, after all the hard work, all the brainstorming, all the tensions in the administration, he would sit and spend time teaching and mentoring a lot of people. And I would, all the PharmDs who have worked with us will agree to the same. And eventually, they have become the key pillars of the institution. And today, Grace, we have a lot of research activities happening, a lot of papers being published by the PharmDs. Grace is one of the ambassadors for infectious disease, SHIA, for the country representing. As a hospital, we are a National Resource Center for Non-Communicable Disease. For the communicable part, we have Grace taking up a big role, and adverse drug reactions monitoring. Now BCMCH is the first in the country because of efforts from the clinical pharmacists. They have surpassed the PGI Chandigarh, CMC Vellore, All India Institute and all. The main reason is because of the efforts of the PharmDs. So with these words, as you evolve, as you embark on a new journey, may God's choicest blessings be with you. May He bless you and guide you. May you be able to bring changes to the country, to the standardization in healthcare, to health education, and may people look up at you and be blessed. Thank you.
Thank you very much, sir, for that empowering speech. Thank you for appreciating our forerunners. But I would like to emphasize that without the support of the medical fraternity, this wouldn't have been possible. So thank you very much.
Nurses are the heart and backbone of healthcare system. We all know how important it is to stress this point. So the next person I would like to invite is Mrs. Minnie Sarah Thomas, Chief Nursing Officer, the anchor of our nursing ship.
Good morning, everybody present here. It is indeed a great honor, great privilege to be part of this wonderful launch. A step taken by the clinical pharmacists. As a proud mother watches her children go from one step to another, that is what I experienced sitting there, especially looking at my little Grace, who, full of grace, achieved this wonderful milestone, again putting BCMCH on the map, launching FCPI in the venue for the launch being BCMCH. Thank you, Grace, and the entire team for what you're doing. The very first statement that was made in the opening remark by our doctor here was a group of brilliant people. This was voiced or echoed again by our beloved Sijo Achin. The other key word that I heard here was like-minded people by you, sir. And there was no, a statement that he mentioned is the group of people who sat together, worked hard, thought about it day and night. We're a group of people where there's no ego, no personal differences. Their goal was to set up a federation which is useful not for the period now, but in days, years to come. The vision of enhancing, empowering each and every clinical pharmacist, be it a trainee, a student, a novice, or a trained, full-fledged clinical pharmacist, is a giant leap. The first stepping stone that you have, the first step that you have taken is a huge leap into the future where you're going to empower lots of people. To the students, to the trainees sitting here, to the interns sitting here, I would like to say, grab it with both your hands. There's a lot of sweat, thought, money invested by the people who launched this, who are the backbone of this federation. And they have the great mind to give it to you, to make it available to you free of cost. It is a blessing. In quality, we say, if anything that is given to you without a cost has no value, please don't consider it that way. This is something people, a banquet prepared for you. Grab it, use it. And remember that if we didn't have any patient, all this is not needed. So application of what you study, what you learn, what you train, keeping yourself abreast and updated with the latest trends, and successfully, diligently applying it to patient care. Believe me, that is a great job that is entrusted into your hands. Patient safety, the best patient outcome through your hands is a blessing. So if God has allowed you to be here, people who are sitting in this room, in this auditorium, and people who are listening to us virtually, following us virtually, please take advantage of this federation, the scope of the federation, the mission of the federation. In the mission statement, they mentioned patient-centered care. So remember all this that we are doing is towards the common goal: quality patient care, safe patient care. So again, let me congratulate the Federation, every member of this team, Grace and all the other members of BCMCH family, for all the work that you're doing to enhance and empower our future generation of clinical pharmacists so that the patient has an experience exceeding their expectation. God bless you.
Thank you for the kind words of appreciation, ma'am. This wouldn't be possible without the support from all of you.
Next, I would like to call on stage Mr. Biju Thomas, Pharmacy Manager, to deliver his message.
Good morning, all the dignitaries, clinical pharmacists, and budding clinical pharmacists. There is a big gap between textbook and patient, and a big gap between university and hospital, university and practice, university and business. You studied A in your college, but you don't find that A in a patient. You will find A1, A2, A3, 1A like that. You come here with some data in your mind, but you won't find that data in a patient. What you find is some values and some signs and symptoms. So this is a dilemma faced by every professional in all fields. This is where you need people, mentors and visionaries like Dr. George Chanti, who taught from his decades of experience and enriched all of you. This federation, I think, will be the right platform to bridge the gap between theory and practice, how to relate theory to practice. And I'm sure that this federation will go a long way in conquering greater heights. And you are blessed with a group of people who are young, energetic, and full of passion and drive. I wish you all the very best in your endeavors. Thank you very much.
Thank you very much, sir, for those warm wishes.
Next, we'll be hearing the remarks from the visionary behind the introduction of Doctor of Pharmacy in India, Dr. B. Suresh, Pro-Chancellor, former Vice-Chancellor of Pharmacy, JSS Ahar, Mysuru. We call upon Dr. Brisha Hana Sakriya to convey the message on his behalf.
Let me read through his message. He is very glad to note that the Federation of Clinical Pharmacists in India, the FCPI, is formed recently with the objective of enhancing the clinical pharmacist profession, empowering the clinical pharmacist, and thereby delivering high-quality patient care. He congratulates the next generation pharmacists who have come together in the advancement of clinical pharmacy concepts in India. The role of pharmacist in healthcare pharmacist has evolved in the last 2 decades, and more so after the introduction of the PharmD program. Whenever the evolution of the pharmacist recognition in the patient care settings will be discussed in the posterity, the introduction of the PharmD program will be considered as the inflection point. There is a significant support being garnered from the medical fraternity as they have found a new ally in their delivering quality healthcare to the patients. The clinical pharmacists can play a pivotal role in ensuring the safe and effective use of medication, and this is being now recognized and appreciated by many stakeholders. It will take some more time for this to make its fullest impact, and till such time the clinical pharmacist has to continue to do their good work with patience and determination. FCPI should work closely with the medical association, other pharmacy association, and other stakeholders so as to create advocacy amongst the policymakers to ensure that the benefit of the knowledge and the expertise of the clinical pharmacist become accessible to the physician and to the patient alike. He also congratulates the FCPI for this laudable initiative and wishes a very best. He also promises to join us in person in future meetings. Best wishes, Dr. B. Suresh, Pro Vice Chancellor. Thank you.
Thank you for the remarks, sir. Thank you is a prayer that cannot be seen or untouched. To express our gratitude, I would like to call up another special invitee, Mr. Mohammad Rashid, Department of Science and Technology Inspire Fellow, PhD Research Scholar, primarily focused on safe and quality use of medicine. He completed his B.Pharm and M.Pharm at JSS College of Pharmacy, Mysuru. He is pursuing his PhD in Manipal Academy of Higher Education under the DST Inspire Fellowship and is trained in the area of health economics and outcome research. He has been awarded with 2 gold medals, including Frank May Gold Medal and Synology Gold Medal for obtaining the highest score in M.Pharm pharmacy practice at JSS. He also received the ISPOR travel grant in the year of 2019 to attend the ISPOR annual conference held in New Orleans, USA. He also played the role of faculty advisor at ISPOR student chapter Adi Chunchanagiri University. To add furthermore, he is the networking and communication lead of International Society for Pharmacoepidemiology Student Council and ISPOR Student Network. Being an alma mater, I'm very honored to call you upon to the stage, sir.
Thank you. Thank you so much. Finally, FCPI is in front of you, and all you are the end users of this FCPI. And the moment where we stand here, I mean the whole team of all our team from various like specialities like infectious disease, critical care, pediatrics, surgery, then research, everywhere. We have a good team, as Hishamka already mentioned, like around 70 clinical pharmacists who's graduated from India, who's working in India as well as abroad. We came together with a so much of excitement, so much of passion and giving back to the society. And today, officially, we are in front of you, though the work has been started 3.5 years back. There's so much of effort, there's so much of things happened in between, so many things happened, and finally we are here and it is in front of you. So now, I would like the final thing in front of me is vote of thanks, the final agenda of the day. And here I am in front of you. Then first, I would like to thank the whole BCMCH because they hosted us here and they gave us the platform. So the whole team, first I would put in front of you, I would like to thank the BCMCH team. Then we have Father Sijo Achan, and thank you so much, sir, for allowing us to be here and launching our program here. We have George Standi, sir, and thank you so much, sir, for your wonderful vision on how the knowledge has to be spread to the student. It is not like, as you mentioned, it's not only from theory. As you clearly mentioned, you gave us such a thought or such an inspirational word or the encouragement in a way that how a clinical student from any specialty, either be from clinical pharmacist or medicine or nursing or any allied product, as you clearly said, it has to be taught with the bedside. So thank you so much, sir, for giving us a good vision to take it further, and we assure you we will take it forward. And we have Dinesh Kumar sir here with us, and sir is one of the representative nationally, as well as he is the one who representing the problems of Kerala as well as all the other things happening in pharmacy, either being clinical pharmacy, hospital pharmacy, community pharmacy. He is the first voice for us. Thank you so much, sir, for having with us. And we have Muhammad Hanifa sir, Principal, Maulana College of Pharmacy, and sir is, I think many of you might have been met him. He's such a polite, such a, he's like a kid if you talk with him, literally. So he's so much love to the students, and he's so much with the kids who is upcoming, and he will give you so much of advice. And thank you so much, sir, for having you here today. And then we have team. We have Shamka, we have Faisalka, we have Maman, we have Grace Chechi, we have all other team, Agil and all of our team. And you know the excitement what they had yesterday, literally they didn't sleep. Okay, Hishamka and Faisalka didn't sleep. I slept nicely because I had a long travel. So that much excitement they had, and the where they take us, literally I'm so like younger to them. They're all my teachers. I had a dream to meet them like 3 or 4 years back. And I met them. I met Faisal Ka in 2016. In Aster Mims, I met Hisham Ka in 2017 or 18 in Manipal when I went to CPCon. I was a student that time. And Graisachi, this is the first time we met, but we were like meeting online long time. So the excitement what they had, or like the team, whole team they brought, like in a way, as he clearly mentioned, there is no ego. There is no ego. It's all like a teamwork. Like as a youngest one in the team, whatever even I could contribute or whatever even I say, it take it in positive way. So the team, the whole teamwork today, I think successful, and we brought in front of you. And now it is not the end, it is just a beginning. There is so much to come. There is so much to come in terms of academics, in terms of collaboration, and in terms of research and publication. There is long way to go, and you are the pillar, you are the support. Any moment you can correct us, you can come up with the ideas, you can come up with the thought, and we will be ready to take it up. And on vote of thanks, we have John Valiat sir with us. He is Associate Director of the hospital, and thank you so much sir for having with us. We have Jomsi George sir, he is the medical superintendent, and thank you so much sir for having and giving us like how you took PharmD graduate, or how you initiated a clinical pharmacy service in a hospital, and how you encouraged us, and thank you so much for having that. And we have Biju Thomas sir, and he gave us a good vision, and he gave us a good appreciation. And we have Mrs. Minnie Sarah Thomas, Chief Nursing Officer. And ma'am, I could see the, like, each part of today, you just explained in few words. From the start till the end, you explained each and everything what happened. Like, actually it was my duty, but you took it up. Thank you so much. And you gave us an overall glimpse what happened so far last 2 hours. Thank you so much, and thank you so much for giving such a nice advice as well to take it up further. And we have Dr. Nitin Manohar and Anju ma'am from Pushpagiri College of Pharmacy, and thank you so much for having us today. And we have Dr. Gayatri. Thank you so much for taking a long journey, and it's really kind of you coming a long way and joining us today, and your part in FCPI is much appreciated. Thank you so much. And now we have the whole administrative team. We have of Believers Church Medical College. Thank you so much for hosting us here and like giving us all the support to conduct this event. Then the heart and soul, Grace Chechi and Piller, clinical pharmacy team of Believers Church. And thank you so much for all the support. Thank you so much for making all these arrangements, running late nights, your preparation. Thank you so much for all those things. And we have pharmacology department, who is strong support of our clinical pharmacy in this hospital. Thank you so much, sir. Thank you so much to the team of pharmacology for hosting us or for supporting us here. We have all the consultant doctors giving a heartful support. As Grace Chechi was telling, they started with Grace Chechi, then 15, then 25. Now they have a big team. Like we say, no, Alibaba and Napatona. But now it is like Grace Chechi and around more than 50 people. They are doing a wonderful job. As I clearly mentioned, they are in the all fields of Believers Church. They are in the administration, they are in the tech, they are in the everywhere. So it's a good team. Make use of, and we have the students of Pushpagiri and other interns here, and I would say you are the end users. All this effort put for you, not for anyone. As Ishamka clearly said, we could have been be in our profession. He could have been a good critical pharmacist. He is a good clinical pharmacist. They are all good clinical pharmacists, and I would have been satisfied with my PhD. Like this, each one of our team, they are made something. They are in a good position but still they put their time aside. It's very hard to keep some time beside your busy schedule, and they all made it. They all made it, and like they struggled a lot, came this much, and it is in front of you, and you are the net users, all the students, all the working clinical pharmacists, or all the pharmacists who are working areas of clinical pharmacy, and you are the end users, and this is for you, not for anyone else. So you have to utilize it. As they clearly mentioned, free doesn't mean that it is not having value. This is having so much of value, and you have to take it up. So I thank each one of you for having us with us, and each one of you who are following virtually with us. Thank you so much for following us. Keep following, keep commenting, keep correcting, keep strengthening, and we'll have a good time. And finally, the technology team who provided all the lights and sounds and everything, thank you so much. And I feel like it's a proud moment. Seriously, it's a proud moment, and you can see that in all of their eyes. Like, it's finally here in front of you. Utilize it properly. Come back with a bang. Thank you so much.
Thank you, Rashid, for that great vote of thanks. Thank you. Please be seated there, Rashid. I would just like to thank the National College of Pharmacy, the students, for your commitment. I know we've been putting you through a lot of trouble in your training, but thank you for persisting with us. And also, I want to, for this event to happen, actually I was not here for the past 1 week. My whole team, I have to say hats off to them for conducting such a good program. Linda, Maman, Akhil, Jyoti, my best components, my best MCs. Thank you so much for making this work in such a seamless fashion. It seems very seamless, but they have put a lot of effort to make this into a wonderful session, wonderful success for the launch of our federation. Thank you so much, guys. Thank you. We are very proud of you.
We're extremely grateful to the Lord Almighty who has blessed us with a beautiful day, and everyone who has been a part to make sure that the event would run successfully. Thank you very much for your unwavering attention throughout. It's audience like you that is the success of this event. So thank you so much, and we'll be moving on to a short day.
Refreshments have been arranged outside the amphitheatre. I request everyone to help yourselves. Following the tea break, we will have the hospital immersion to give our budding CPs a glimpse of our ideology. This is mainly organized for the external college students, basically to introduce them to the clinical pharmacy activities in few chosen departments by clubbing them with the CPs of concerned departments. I request everyone to kindly disperse for the tea break. Thank you. Your kind attention, please. Your kind